Welcome to our FB Live session. Today we have with us Dr. Jayalakshmi TK, Consultant Pulmonology at Apollo Hospitals, Navi, Mumbai.
Hello viewers.
Today we will discuss about Omicron Covid-19 variant. So doctor, my first question is, what is Omicron variant?
So this is a new variant of Covid-19 which was first detected in South Africa in October 2021, and since then it has spread, of course in South Africa, but all over the world. So now we are seeing very high numbers of this variant in South Africa, in UK, the European countries, US, and even in Australia, and practically throughout the world. And now it has started increasing in India as well. The technical name for this variant is 1.1.529. But more than the name, the important thing is that there is a lot of variants on this virus, on the spike protein. About 30 variants are there, probably more. And this makes it, this makes the interaction, the spike protein is a part of the virus which attaches to the human receptor cells on the airway, that is in the inside of our nose and throat. So this variation in the virus protein makes it much more easily able to attach onto the nose and throat and multiply much faster, thereby able to spread much faster.
Doctor, what are the symptoms of this Omicron variant? Are they same as a common cold?
So because the Omicron variant attaches itself in the inner lining of the nose, throat, pharynx, and even the bronchi much more easily, it causes mostly cold-like symptoms. That is sneezing, watering nose, dry cough. Also, it causes fever, body ache, headache, nausea. So these are the symptoms which were seen. So in South Africa, and even in UK, 50% of all the colds, which we normally call a cold, are turning to be Omicron. So which was not the case in the earlier Delta variant, where if you had a lot of sneezing and cold, then you said, okay, I have a lot of sneezing and cold, so it is not COVID. But now it is not like that.
Doctor, will the hybrid immunity work against this Omicron variant?
So hybrid immunity is what we call that person has taken vaccine also, and person has got the infection as well in the earlier waves, probably the first or the second. So the immunity does work. Important message I want to give is that vaccine immunity does work against preventing severe illness. We see that the unvaccinated people are more than 10 times as likely to get a severe infection which may require hospitalization, and also very much more likely, about 4 to 5 times more likely than the vaccinated to have ICU admissions. So although you can still get the infection when you are vaccinated, even though you are vaccinated, but the infection is likely to be much milder in the vaccinated people.
Doctor, is the booster dose of the Covid-19 is vital to fight the Omicron?
So what is being seen is that after the second dose of the vaccine, the antibodies are formed and which are detected in the blood, but these antibodies start going down between 6 to 9 months. But there is another immunity called as a T cell immunity or the cellular immunity, which remains for a much longer time. It is being seen maybe that the mRNA vaccines at Pfizer and Moderna may give a lesser duration of immunity than which is seen with the Covishield, but we are not sure about that. But definitely a booster dose helps to again increase the antibodies. These antibodies start coming up within 1 week of taking the booster dose and reach a peak within 3 weeks. So that is the time it takes for the booster dose to start becoming really efficacious. And it is seen in South Africa as well as UK that the people who have taken the booster dose are about 7 to 8 times less likely to have a serious infection than those who have even got double vaccinated. So that is the increased protective effect of the booster dose.
Doctor, does the Omicron affect any particular part of the body?
So the Omicron is seen to mostly affect the upper respiratory tract, that is the nose, throat, pharynx. It is seen to affect the lungs much less. So it is seen that probably the viral, because of the mutation in the spike protein, that part which attaches itself to the receptor cells inside the lung does not work as well, and hence the virus causes less of lung involvement than what was seen with the Delta variant. This is a very good and heartening news. So that is why there are much less people on oxygen in the wards or even requiring ICU or ventilator. This has been seen across in South Africa as well as UK as well as in US, and but it mostly affects the upper respiratory tract.
Doctor, will the existing treatment work against Omicron variant?
So the existing treatments will work against the Omicron variant, and the treatment modality is more or less the same as seen with what we've seen with Delta. The monoclonal antibody treatment, the cocktail, may not work, which is already there, may not work as well against the new variant because the antibody type changes depending on the spike protein. There are newer antibody cocktails which are being derived. There are newer drugs also now available, like molnupiravir and Paxlovid, which molnupiravir has already been available in the Indian market. So otherwise the treatment modality will remain mostly the same. So the treatment modality will be to give oxygen for those who require it, mostly give only paracetamol for those who are mildly symptomatic, home quarantine for the mildly symptomatic. Only if oxygen requirement is there or severe illness is there or persistent high fever is there, then require admission. And most of the medications and the antibody cocktail will be reserved, as well as remdesivir, will be reserved for those who require, who are at high risk for getting more severe infections, like those who have heart disease, kidney disease, who are immunosuppressed, who have severe lung disease. So for those, my advice for the people who are mildly infected is stay at home, quarantine yourself so that you prevent others from getting the infection from you. No need to rush to the hospital unless you are very severely sick or unless you are immunocompromised or have other comorbidities, or your saturation is low or you are feeling breathless and require oxygen.
Doctor, my next question is, will the senior citizen benefit from the precautionary dose of Covid-19 vaccine?
Yeah, so as we already talked about the booster, the booster has been approved in India for senior citizens, for healthcare workers and for those with comorbidities. In comorbidities are included people with lung disease, people with heart disease, ischemic heart disease, chronic kidney disease, any person receiving immunosuppressive medications, persons with malignancy, people on chemotherapies, and such other illnesses which can reduce immunity or cause worse illness, which cause increased chances for more severe infection.
Doctor, what is the best way to stay safe from this Covid-19 variant?
So the best way to stay safe, again, same advice as what we had given in the second wave. Because this illness spreads so fast, we cannot say that no, we will completely avoid anybody from getting it. But we can at least try to flatten the curve. For this, we must take our precautions. Don't go out unless absolutely necessary. Wear the mask, do hand washing, practice the social distancing, maintain your immunity by eating well, sleeping well, taking supplements, doing proper exercise. So keeping yourself very positive. So that. Thank you.